talking to, hospital manager locally here. And I had asked a question several times, how many patients do you have in intensive care in COVID? They said 25, okay. And now, a lot of the medical people are furloughed, is that correct?
SSM specifically furloughed about 2,000 in April.
So that is a problem.
That is a problem, and I think you lay off a bunch of people in March and April, and you expect them to come back for the same pay in November during the height of a viral pandemic. That's a problem, I agree.
That's a problem. So there were 25 people, as stated by this doctor, that's in the hospital beds locally here. And I asked them, how many were in the hospital beds this time last year from the flu in intensive care? Circumvented the question, then finally came around to it after Mrs. Lycom asked him for a
Right.
time, how many people did you have in 2019? 25, the same number.
Yeah.
And so this number that you keep hearing, we're overwhelmed, we're overinflated. Well, a hospital typically runs at 85 to 90% to be profitable, is that
Right,
correct?
that is
And so the hospitals, when you talk to them, they're at 90% in a flu season, which
Yeah.
is, right now is the flu season. So how is anything different than it has been in the last several years?
And according to KMOX this afternoon, that number is 77%. I've heard the number 90% from Garza over and over again, but his own pandemic task force this afternoon said 77%. Or to put it another way, Joe, when Steve and I spoke to Garza and others at the very beginning of all this, late March, we asked, how many ICU beds do we have in this pandemic task force region? The answer was about a little over 1,000. How many are in ICUs today in the whole region with COVID? It's about 200, so about 20%. And you're right, influenza seasons can be pretty bad too. Hospitals, the nature of hospitals is that they can surge to improve capacity when they need to. Therapeutics have improved, our death rates improved from COVID-19, average length of hospitalization from COVID-19 has improved. So all those things help us deal with capacity. But although I have to say, this is a little frustrating as a legislator because I am a big proponent of repealing our certificate of need law. There's no reason a hospital should have to come to politicians to get approval for new hospital beds or to buy an MRI machine, and yet the Hospital Association lobbies to keep CON because they want to keep away competition, they want to reduce the number of beds. I mean, we know here in SSM just downsized emergency room operations and closed their obstetrics ward. So, I find it somewhat hypocritical that hospitals are saying, well, gosh, we have too many hospital beds in the region, and then the next flu season, they're crying for help. Hey, it's a real problem, don't get me wrong, I don't mean to belittle it, but I would say as of Friday, Ms. Kaiser told us that SSM was still doing elective procedures that are more profitable than treating flu and COVID patients.
Well, the fact that they always talk about death rates, and the death rate actually was higher last year than it is currently right now. So there is no increase in death rates in the country. So
Yeah,
there's some numbers that aren't adding up.
Yeah, COVID death rates are different than influenza rates depending on which population you're looking at. Children, it's lower, and older, sicker folks, it's higher.
Mr. Crum, have you read the St. Louis University study?
Oh, yeah, yes, so there was a study by the Department of Health and Social Justice, who are the three primary authors, and then I think the fourth author was Commander Garza. It is impossible, it's frustrating, it is impossible to interpret that study because, first of all, he doesn't even tell you which mask mandate, the county.
It was a sheet, and I read it, okay, and the thing of it is, it compared our growth of infections since July, compared to the other surrounding counties. Let me finish a second, okay? And basically, counties with mask mandates got 40% less new infections since July than the other counties that don't, including ours, Franklin, Jefferson, and that. Suggesting masks are wonderful, that's just a perfect world, it'd be fine. Look around this place, did that work very well? This place doesn't look any better than that bar you threw up on the screen, okay? Our own public information, Doug Ballnick comes out, and we we get this on Wednesday, he says 40% of our total cases occurred in the last month. 8,000 new cases in this county. This thing's exploding. I have a best friend who's a VA doctor, who's retired in Colorado, got called back to active duty. He's working 14 hours in Denver right now. He's telling me, you ain't seen nothing yet, but it's gonna get way worse. So, you know, when all the medical professionals, except you, are saying mask.
No.
Let me say, that St. Lucie,
A little respect, please. Thank you.
that St. Lucie study is impossible to interpret because all they do is report these percentage changes. They don't tell you what day they
I
started, what
went
they
to college
finished.
for 6 years, and I read it, and I understood.
No, they only reported percentage changes, Joe. I understand that they asserted that there were these percentage changes, but they didn't tell you what their raw data set was that they were working off of. And I've asked Garza for that, and it's not been provided today. So if you wanna talk studies, and I'm the only doctor, so the CDC's Journal of Emerging Diseases published an article in May of 2020. It analyzed 11 studies it thought were the best done controlled studies of the effect on community use of masks to prevent influenza transmission. 0 for 11 studies proved efficacy. The best done controlled study on COVID was published in the Annals of Internal Medicine. By the way, Lars's study, the SLU study, isn't even published yet and it's not peer reviewed. So CDC's journal, the Journal of Emerging Infectious Diseases was the 11 studies. The Annals of Internal Medicine, the top internal medicine journal of the study, Danish investigators randomized 3,000 people to wear masks, 3,000 not to wear masks, no difference in COVID infection rate. So don't say I'm the,
Without a mask?
I'm sorry?
Did you have surgery from a doctor without a mask?
Inpatient is different than outpatient, and surgery is different
It's the
than
same
walking
principle.
through Walmart.
You're trying to keep germs out of other
And
people's.
besides, Walmart already requires a mask. I would suggest the fact that you have some non-mask wearers in this room, part of that is what's known as civil disobedience, Joe. And I predict that if this council mandates masks on this state, it will be the last day some people in this county wear masks. I will continue to wear masks. I think they may do something, but Joe, it's not like Holy Writ from Mount Sinai that masks are effective as Commander Garza thinks they are.
He's a doctor.
Yeah, I'm a doctor too, and so are the authors of the New England Journal of Medicine article that was a negative study.
Mr. Hanley.
I don't really have any questions for you, I just, want to share my personal experience, since I recently